How's it going, guys? We have a medium difficulty question for Immuno pediatrics. 3-year-old boy. He's got recurrent skin pulmonary infections, silvery hair, nystagmus, mild hepatosplenomegaly, fair skin compared to his 6-year-old sister, neutrophils containing giant granules. Now, it's a very pass level diagnosis for Chiari-Kagashi syndrome. Some of you say, Mike, this is too easy. That's fine. Well, we asked you more difficult answers, didn't we? So the inheritance pattern, correct answer is autosomal recessive, defective phagolysosomal fusion is how they can write the answer. And the reason you have partial albinism is because you need phagolysosomal fusion for melanosome function and transport as well. So the USMLE can write fair skin compared to a sibling, and you get these giant granules within phagocytes. Very buzzy for Chiari-Kagashi. Now let me give you some other info that's high yield for USMLE. If we have this answer, AR, with the integrins, this is leukocyte adhesion deficiency, LAD, deficiency of CD18 LFA1 integrin. Leukocytes cannot diapedese. They cannot move from the vascular lumina into the interstitia. And the two ways they'll describe in USMLE, number one, delayed separation of umbilical cord at birth. That's only about half of questions. That's the one most of you know already. The other one is absent pus at sites of infection / in the skin. Very easy for LAD. Okay, they'll just have what's deficient in this patient. The answer is just an integrin. That's what they'll write, an integrin. It's not hard. Wrong fucking answer. Then we've got X-linked recessive impaired leukocyte receptor function. This could be X-linked SCID, okay? So severe combined immunodeficiency, X-linked variant, IL-2 receptor dysfunction / common gamma chain mutation, autosomal recessive variant, adenosine deaminase deficiency. So you're gonna have fungal, viral, protozoal, bacterial, all the different organisms for infections. Scanty lymph nodes, tonsillar tissue. That's B cell deficiency, absent thymic shadow, T cell deficiency, and those descriptors are very high yield for either eliminating SCID or knowing it's the answer. Because, for instance, if they give you congenital HIV infection, students are like, well, how do we know that this isn't SCID with all the infections here? It's because they say that there's many palpable lymph nodes, so it can't be a B cell deficiency. And likewise, if they wanted Bruton, they'll tell you there's scanty lymph nodes tonsils because there's B cell deficiency. So let's just whip through the final ones. X-linked recessive NAD pH oxidase deficiency would be chronic granulomatous disease. So it's usually XR, can be AR, but that's your susceptibility to catalase positive organisms: Staph, Serratia, Pseudomonas, Aspergillus, Candida, E. coli, Burkholderia. And then we've got this final answer choice, X-linked recessive T cell dysfunction with cytoskeletal issues. That's Wiskott-Aldrich syndrome. Okay, so what they're going to do, give you a very buzzy triad of thrombocytopenia, eczematoid skin lesions, and history of infections in, let's say, a 12-year-old boy, and then the answer will just be T cell. They'll list all the different types of cells: B cell, T cell, macrophage, neutrophil, etc., and the answer is just T cell. Wrong fucking answer. You know the deal. I'm 2 make more content on my social screen. Appreciate your time. That's it.